In tonight's Eye on Your Health, managing diabetes in the modern age. For many people with diabetes nowadays, monitoring blood sugar can kind of feel overwhelming still, but there are some new tools out there that are changing that, offering some clearer insights, maybe a little bit more peace of mind. We have Dr. Sarah Saprasad with us tonight, endocrinologist from Baylor Scott White, here to explain. Thank you for being here, by the way.
Thank you for having me.
So for somebody living with diabetes, what sort of difference, I'm curious, is technology making? I don't deal with it in my own little circle, so I come from it from almost zero knowledge. So what is technology doing today for it?
I would say technology is making a very significant impact in the life of diabetics. It helps reduce the stress out of the management of this chronic disease. It takes the guessing game out, and then they can see data in real time, so they are confident to make decisions.
Yeah, and it was traditionally, if I understand correctly, it was you had to prick your finger or something, you had to draw the blood, you have to analyze the blood. But nowadays, are there wearable devices?
Absolutely. So continuous glucose monitors, or CGMs, are sensors that patients wear, and that eliminates or reduces the need for doing finger pricks. Similarly, another technology which we will be talking about is the insulin pump, and that eliminates the need for needles, insulin injections.
Yeah, so on the pump side, because I do want to ask you about that, the newer automated systems, it's referred to in some cases as an artificial pancreas.
Correct.
That sounds like a pretty good piece of technology to me.
Yes, yes.
Tell us more about that. Why is it so good?
So an insulin pump is a device that patients wear, and it delivers insulin continuously. What we can do now is we can integrate the insulin pumps to continuous glucose monitors. So then the pump delivers insulin guided by the blood glucose. So this is similar to what our body does. So we have the pancreas, and the pancreas secretes insulin guided by the blood glucose. So the pump technology is developed to mimic what normally happens.
So what should be happening in the body.
Yeah. So that way patients can achieve better control of their diabetes, and there will be less fluctuations in their blood glucose control too.
So is all the technology and where that growth has occurred, is it only for people with type 1 diabetes, or can it also help people with type 2 diabetes?
I would say both. It's usually the standard of care for a type 1 diabetic, but it can also be used in a type 2 diabetic. I would say anybody who is needing more than one insulin injection per day can be benefited by using an insulin pump.
When we talk about technology, what would you advise, like if you had a family member or a friend or something like that, and they were maybe in another state and they're going to see somebody regarding the diabetes and the technology that's available today, what would you advise them to ask their doctor? What suggested questions might you have for them?
So I would say first discuss honestly about what are your concerns, what are your challenges, what is bothering you. Is it the finger pricks? Is it the insulin injection burden? Also ask what technology is out there that may be suitable for you. And it's finding the right technology that meets the patient's needs.
So let me jump in there. So not necessarily a one-size-fits-all for everybody. What may work for you may not be the best for my life. Is that,
absolutely.
Is that what I hear?
So the patient and the physician together can make the decision as to what technology would work best for the patient.
Okay. Dr. Sarah Saprasad, she's always so wonderfully knowledgeable. Thank you for being here. We appreciate it with Baylor Scott White. Thank you so much again.
Thank you for having me.